Hi, and welcome to the fundamentals of the squat, bench press, deadlift, and overhead press for 4Js. My name is Justin Clifford. I'm a physical therapist with Air Force Special Warfare. I'm board certified specialist in both orthopedic and sports PT. I'm certified strength and conditioning specialist, and I've been competing in strength sports for about 15 years now. So let's get going. In this video series, we're going to go over the foundational technique for the barbell squat, bench press, deadlift, and military press. We will introduce a handful of modifications to each lift that can be used to adapt the lift to a given lifter or patient. We'll go over a number of effective cues and identify common principles between the lifts in order to appreciate why these lifts are useful and how they can provide carryover into performance or injury prevention. So why are we going over these lifts specifically? For one, they're ubiquitous in strength and conditioning programs. They're considered fundamental because they check a lot of boxes, are straightforward to coach and train, and have stood the test of time. If you are working with athletic populations, including tactical populations, you need to know how to perform and teach these lifts on at least a basic level. You're expected to be at least basically competent in these lifts. Why are these lifts ubiquitous? Why are they so fundamental to strength training? Because they work. We know that training them consistently is a very effective way to improve physical performance. Third is the matter of training economy. These lifts stimulate a lot of tissue at once. That is very time efficient, great bang for the buck. Strength training is also shown consistently to reduce injury risk. On one hand, injuries happen because demand on the body exceeds the capacity of the body in some way. So how do you prevent that injury? You either decrease the demand or you increase the capacity. And strength training is a fantastic way to increase that capacity. On the other hand, a lot of our patients hurt themselves in the gym, often as a result of training incorrectly. You've likely seen it. Knowing how to correct their technique or help them perform the lifts more efficiently so that they can get back into lifting with less time away from training is very beneficial. So in this video series, we will not be going over programming. This is a very important topic. It is a very big topic. It is different enough that it would distract from the technique instruction and principles of performance that we're trying to go over here. There are a lot of resources dedicated to this. We just don't have time to go over them within this space. We are also not going to cover every single variation or modification that can be made to these lifts or every single cue or coaching process out there. We will go over the foundations, but realize that there are so many options for manipulating load, range of motion, degrees of freedom, speed of the movement, etc., that we could spend multiple days covering a single lift and all of its variations. I do recommend checking out some resources on things like the conjugate method that have a lot of variations that can show you how to manipulate load, speed, and programming that can be very beneficial in some rehab and performance settings. We're also not going to cover that one thing that all of your patients must do in order to not get Ebola in their spine or win the Olympics in every event or whatever. These kind of tricks don't exist, and there is no replacement for simple, hard work and time under the bar. Understanding fundamental principles is a necessity, as by definition, everything else is built from them. In the case of human performance, whether from a rehab or a high-performance perspective, the specificity principle is key. Sometimes called the SAID principle, standing for specific adaptation to imposed demand. It states that the body only adapts when it is stimulated to do so, and in the way that it is stimulated to do so. You can think of this as the use it or lose it principle. If I put my leg in an immobilizer for a few weeks, my quad and other muscles will atrophy because the demand on the quad has been eliminated. If I want to get that quad back, I need to make it work. I need to put a demand on it in a way that will stimulate adaptation towards hypertrophy, strength, energy utilization, or whatever else my goal is. If I just left it and waited for it to get bigger and stronger, it would end up just getting smaller and weaker. The discovery of this principle by those caring for the war wounded returning from World War I led to the foundation of the physical therapy profession. The flip side of that is the idea of generalizability, or whether or not a training adaptation will carry over into other aspects or applications of performance. If I build someone's squat and their 1 rep max goes from 45 pounds to 135 pounds, I can reasonably expect that they will have at least a little bit easier time with climbing stairs while carrying a load because of increased leg strength. However, this effect can be somewhat directional. If I have a rank novice, someone with zero training history, we train up their squat, I can actually expect their grip strength to increase a bit, even though the squat is not thought of as a grip exercise. This is because the squat is teaching them how to coordinate a lot of musculature to produce high force. And when starting from a very low level of performance, you will see big gains in this coordination very early on in training, and that can increase grip strength pretty dramatically. However, if I take that same rank novice, do not train the squat, and I only train the grip, I'm probably not going to see that much carryover into the squat, but possibly into carrying things if the hands were a limiting factor on that loaded carry. There are, of course, limits to this carryover as well. There's good evidence that strength training, up to a point, can improve running performance, specifically by increasing running economy. But there will obviously be diminishing returns if an endurance runner shifted to training bodybuilding for a couple of years, hoping that that alone would improve their run times on an ultramarathon, for example. Rather than thinking of specificity and generalizability as opposite sides of a spectrum, it is perhaps better to think of them as complementary, with general physical preparedness, or GPP, forming the foundation of fitness. Think fundamental strength, endurance, agility, and mobility capabilities that support the specific abilities or skills that we refer to as special physical preparedness. This is your technique work, your skill development, your sport or job-specific training, and so on. Different activities will require more or less GPP or SPP, depending on the task, but the principle is that without sufficient GPP, without a foundation of fitness, the skill work cannot be meaningfully executed. For the majority of people, the barbell lifts we will introduce will help with the development of this fitness foundation. Exceptions might be for people like powerlifters, strongman competitors, weightlifters, crossfitters, etc., where the lifting itself is part of the actual sport. In those cases, these lifts could develop both GPP and SPP. Okay, there can be some pitfalls when we're talking about barbell training, so I want to get these out of the way. Broadly, they tend to fall into two related camps. First camp is the fallacy of thinking that barbells are the best or the only way to train these lifts or to get these training adaptations, and that you don't need to consider any other means of training or loading your patients because barbell movements can do it all. The second camp is making the mistake of thinking that because we're teaching these lifts with barbells, that if a person doesn't have access to a barbell or for whatever reason can't use a barbell or they're scared of lifting a barbell, that the principles of training these movements can be ignored or as either inappropriate or unneeded. My patients don't go to the gym, so they'll never need to use a barbell. Now, there is an element of truth to both sides here, but they both take the perspective too far. The barbell is being used as a tool, nothing more. It was basically invented because rocks are hard to lift and train with. Barbells allow you to get closer to the weight so you can learn better mechanics of moving under load. Barbells are versatile in that they can be used to train a bunch of different movements. They can be progressively loaded in any increment, large or small, to dial in the weight as needed. They're consistent in that they tend to have standard dimensions and features, and they're common enough that they can be found practically anywhere. They're ubiquitous in performance settings and in base gyms. That isn't to say that one couldn't train these lifts with a suitable rock. Personally, I'm a huge fan of lifting rocks. It's fun, largely because it's such a different challenge. Every rock is different, and it's like a puzzle trying to figure out how I'm going to pick it up each time. That difference, that puzzle, can be a problem for the reasons that we just discussed. It can make it hard to learn these specific motor patterns or to load them incrementally. Similarly, while deadlifting or squatting with a rock can work pretty well if you can pick it up, doing a chest press with a rock is pretty sketchy if you miss the lift. And there are very few lifts that are scarier than trying to press a round stone over your head with a poor grip. So for now, we're going to use barbells. Don't get too locked into it. Other means of loading exist and can be beneficial. Just don't disregard what the barbell offers in terms of efficacy, simplicity, and consistency. That's what tools are for. So what do all of these lifts have in common with each other? The squat, the bench press, the deadlift, and overhead press all involve wedging ourselves between the weight and the earth. We have to transmit that force through our bodies from our feet to our hands. This teaches you how to create maximal volitional stiffness in the trunk. That creates maximal stability from which we can push stuff around and manipulate our environment. This bracing will include the abs, the paraspinals, the pelvic floor, the diaphragm, the lats, the intercostals, the quads, the glutes, and any other muscle that is not directly moving the load. All of these lifts are full body lifts. Anywhere we are loose is a place for energy to leak from the system, and we lose the ability to transmit that force above or below. One good way to train this, if you're unfamiliar, is doing something like a hard style plank. You start in a normal forearm plank, you do a max effort squeeze of your quads and glutes, you hold that, you add an ab contraction as though you're going to take a punch. And then finally, you try to pull your elbows to your toes as if scrunching the floor underneath you. You're trying to create maximal tension in an anti-extension position. This should be kind of a max effort type drill, very short duration, about 10 seconds. If you can hold it longer than 10 seconds, you're doing it wrong. So have fun with that one. The other piece they have in common is efficiency. The human body is generally pretty good at figuring out how to move when we let it and when we give it a task. And while we don't have good evidence that showing one particular technique or form is inherently more dangerous than another, we do know that some techniques are more efficient than others by either increasing the amount of muscle involved in a lift or shifting the load away from less robust structures. We are able to lift more weight with less risk. Other techniques might not be explicitly bad, but they're going to load things a little bit in a little bit more focused way. And they're going to be less efficient. They're going to use less muscle, and the loads will be limited as a result. For the sake of these videos, we are going to be mostly teaching these lifts from the perspective of powerlifting, which focuses on maximum weight lifted through a standardized range. This gives us the best foundation to start from a place of maximum stability and moving heavier loads that way, which can then be modified as needed to fit the goals of the patient or the lifter. It doesn't mean that this is the only way or the only safe way to do these lifts, but it is a very efficient and stable way to train them, and then you can branch off from there. Speaking of efficiency, by using more muscle in a lift with sufficiently heavy load, we get a huge training stimulus across a lot of tissues. This might be all a given tissue needs to adapt. It might be good enough to maintain or gain strength while we work on other training modalities more specific to the patient's goals. However, that also means that these lifts are not that great at targeting specific tissues. Because the body can figure out how to move, there's so much muscle involved, it can favor certain areas if it doesn't want to load certain areas, or if certain parts of the body fatigue early and limit progress. A classic example of the first is quad strength after an ACL reconstruction. The quad is inhibited from surgery and needs to be strengthened. And the squat is typically thought of as a great way to strengthen the quads, right? But if the brain doesn't want to push through that quad, it might compensate by adding more load at the hips or the ankles or the other leg to execute a good-looking squat, but with less quad work from the quad you're trying to train. This would make the case for the importance of isolated quad training where the body can't compensate away from the target tissue. Another example might be the limitation of grip strength in the deadlift. If the hands are fatiguing and limiting the amount of work that we can accomplish in training the deadlift, the addition of using straps or hooks might be beneficial so that we can get the training stimulus that we want in the deadlift without the hands being the limiting factor. All of these lifts can be modified in a few common ways. Range of motion can be modified to protect certain ranges, overload a specific part of the lift, or train through a variety of positions. Examples might include things like a box squat, deadlifts from a block or from a rack, deadlifts from a deficit, that is standing on a plate or a block to increase the range of motion, pin presses, etc. Load can be modified by making the weight on the bar not only heavier or lighter, but also by having the lifter move faster or slower during certain parts of the lift. The load can also be manipulated across the range of motion using something like accommodating resistance in the form of bands or chains that make the weight heavier at the top of the rep and lighter at the bottom. This is actually a fantastic technique for when you want to train a full range of motion, but you want to protect or unload the bottom portion of the lift. Setup can also be modified, and that includes those aspects of form that don't change once the bar is in motion. Things like foot placement can change relative loading in each of these lifts, as can one's choice of grip, since these are the contact points between the load and the earth. Bar position can be modified with regard to where the bar rests on the upper back or touches on the chest, or the bar height in the rack before performing the lift. And the use of a spotter can facilitate parts of the setup to help the lifter more easily reach a stable position prior to executing the lift. And finally, equipment can also be used to help change the stresses of the lift or bolster areas that might be more of a limitation. Examples can include assistive gear like belts, straps, sleeves, lifting shoes, specialty barbells or blocks or wedges, and we will show some examples of these in the video demonstrations. A few words of caution when we're coaching these lifts. Try to give the lifter or the patient you're working with as few cues as possible. We are going to go over several different cues for each of these lifts. You don't have to use all of them every single time that you teach. Just like if you were to do a running assessment on somebody and you were about to ask them to run, you wouldn't spend 20 minutes talking about how to advance one foot over the other while swinging the contralateral limb and talking about heel strike and weight bearing and flight stages and all of this other stuff. You would just ask them to run and see what it looks like. And then you would back off and then you would look at those specific things that they needed. You'd make small corrections. These are fundamental movement patterns that we're teaching. You can demonstrate the lift with the barbell so they know how to set up and what it should roughly look like, but if you're going to teach it, make sure that they perform it without too much instruction first, and then find out those cues that you need to give the patient or the lifter, the ones that are going to get them the best bang for the buck. You don't have to over teach these lifts, and you don't have to accomplish everything in the first session either. Also, accept that there is no universal perfect form on all these lifts. If you see small deviations, don't worry too much about it until you start getting into higher loads and higher volumes where that efficiency matters more. Additionally, everybody is built different. There are going to be different angles in the joint sockets, in the angles of torsion, in limb length, and so on. You don't have to force everybody's lift to fit a certain box. Remember to change the lift for the patient. Don't change the patient for the lift. Remember also that motor control is load and speed dependent. So when we look at these lifts with low load, say with like a PVC pipe even, and then we put a barbell on their back, those might not look the same for that person. How fast they're moving might also make a difference. Where the inertia from a fast movement with heavy weight might carry them through a sticking point. That might be good, that might be bad, depending on what we're trying to do. We want to respect fatigue. When we are teaching these lifts, especially for the first time, we're going to go through multiple sets, multiple reps. There's going to be some iterative process to this teaching. And you want to make sure that you understand how much work your patient or your lifter is actually doing during that instruction. There will reach a point as you are coaching that the technique does not get any better despite you not making the weight any heavier. That could just be due to fatigue. They could also just be done for the day and you're not going to make any additional progress. You don't have to get everything done in a single session. And finally, make sure that, especially if the patient is new to lifting or if they haven't lifted in a while, prepare them for delayed onset muscle soreness. This is a normal side effect of beginning new strength training. It's not specific to these lifts in particular. It's specific to just high effort resistance training that has not been trained recently. It does get better over time through something called the repeated bout effect, but just make sure that the lifter or the patient is mentally prepared for this so that they can distinguish between pain from their injury or their condition that they're coming to physical therapy for and the soreness generated from those lifts. Make sure they're ready to distinguish those two. And with that, let's go on to the demonstrations.